chronic disease diagnoses. Will the county have enough healthcare workers to meet the increased demand? Outlook Montgomery takes the temperature on the healthcare worker shortage.
This is a time where there are children and their families who need nurses to take care of them, and we don't have enough.
Montgomery County is facing a measurable healthcare workforce shortage, now more than ever.
Our healthcare professionals are getting older. The population of our healthcare professionals, the average age is much older than you would think. And I think that's the big reason right now for the shortage. A lot of our healthcare professionals are choosing to retire, and our population that we take care of is getting older. So we have all these baby boomers now, and they have lots of comorbidities, and they're actually sicker. And it's a big strain on our workforce. That's mostly why we have this shortage right now.
In Maryland, the vacancy rate for nurses, physicians, and other healthcare providers who deliver direct patient care doubled from 7% to 14% from 2014 to 2018, according to the Baltimore Post-Examiner. In Montgomery County, there have been more than 4,800 healthcare job openings on average per month this year, but only 36% of those positions were filled. In the D.C. metro area, that number is even lower at 28%. For those working on the front lines of healthcare, the workforce shortage is palpable.
We have a shortage of nurses, and then the unit is constantly asking people, like, can you come in? We're short on nurses, like, we need help. So now we need help. But people are burnt out. So it's really tiring and it's really stressful.
So what can be done to close this healthcare workforce gap?
So one way is through enrollment. We've increased our enrollment. Once we have the students in our programs, we are providing them with quality education. We have state-of-the-art labs, state-of-the-art equipment. We've had outside visitors come to our college, and they're just in awe of how phenomenal our labs are and how well equipped everything is. We do lots of simulation, and we're a center for simulation. We advise our own students. So we are working with our students from the day they come in until the day they graduate. We offer a really good education for all of our programs. In our health science programs, once the graduate graduates, they are ready to hit the ground running for immediate entry into the workforce.
Advancing student education is the best way to secure healthcare jobs available now and in the future.
The education at Montgomery College in the health science or nursing program is a huge value because it definitely changes your life, and it definitely changes the lives of the people that you take care of. And then now for me, I graduated in 1986, and I would have never thought that an associate degree would impact me so much.
We were sent to clinicals in the fall, and of course we were all nervous. But as soon as we got there, I realized that the exact things that they were teaching us in class are the exact things that we were doing in the hospital. So I realized that all I had to do was trust the process, and I was going to get through it. And sure enough, what they teach in class is exactly what we use in the field. And that just really, really emphasizes the value of this program to me. It's not theory and fluff, it's actual practical, hands-on, real-world application.
It prepares you so much. Like, I can't speak highly enough of the program that I'm in. The labs that we do, how hands-on we are with each other when practicing positioning, making sure that we are positioning patients right, not touching them too much, using our vocal instructions to help guide patients. So I think just the resources that we're given in terms of our technology at the school itself has helped us so much for when we go into our clinicals. We already feel a better sense of confidence while we're learning. And our clinical sites alone are just amazing. Like, they all just want to help us and teach us every little tip and trick they know to get us prepared when we're out there on our own.
As a nurse, you have to work together with a lot of different professions. You have to work with the doctors, physical therapists, the nutritionists, like that kind of thing. So being able to collaborate with different people and like really work together very effectively without stepping on each other's toes, but all with the sense of we're all working towards one unified goal. And so at MC, they've really taught me that all of those principles I've been able to carry on to my nursing profession to really effectively care for patients Our goal is to maintain patient safety and to get them home. So that's our unified purpose. And keeping that in mind has helped me work as effectively as possible as a nurse. And I've learned all of that from my time at Montgomery College.
Whether it's a certificate or a degree, you really are going to change your life and you really are going to have a huge impact on the community.
Start a career as a healthcare hero. Visit montgomerycollege.edu/health sciences. Big issues, local impact. Outlook Montgomery.